Hi there. Thank you for tuning in today. We're coming to you live from Franklin Lakes here in New Jersey at the home of one of our patients. We are here to talk to you all about Caroline's hip condition. She came to HSS looking for help about a year and a half ago, and she's here to tell you all about her overall experience and what type of symptoms that she was diagnosed with, the type of treatment options that her doctor walked her through, her overall recovery. She's someone who has a very active lifestyle, and she'll be talking to you all about that. And we are joined here as well by her parents to share with you all the different perspectives on what exactly brought Caroline to us for care and how she is doing today. So before we get started, Caroline, if you can first introduce yourself.
Yes. So my name is Caroline Haywood. I'm 17 years old. I'm a rising senior, and I'm really happy to share my story with all of you and maybe help answer some of your questions.
And who are you with?
This is my mom, Regina Haywood, and my dad, Bruce Haywood.
Hi everyone, glad to be here.
Glad to be here and answer any questions.
And just so you all know, we actually learned about Caroline's story about a year ago. Caroline submitted on our Back in the Game Patient Forum. That is at hss.edu/Back in the Game. Caroline's story is one of over 1,700 that we now have of real-life patients sharing their story about what brought them to HSS and how they're doing today. So if you have any questions during this broadcast, feel free to comment below. If you happen to watch this after we go off the air, we will still try to answer as many questions as we can. And as always, if you have specific questions about a medical condition, feel free to comment below, and we will try to serve that to Caroline's doctor and go from there. So Caroline, why don't we start at the beginning? So a year and a half ago, you're going through your business as usual. Mm-hmm. Can you just talk about all of the different sports and the activities that you were involved in?
Yes. So it kind of starts back to my freshman year of high school. I was a big cross country and track runner. I did all 3 seasons, and going into my sophomore year, I really wanted to really excel during that cross-country season. So every single day I was training. I was doing really heavy mileage and different cross training, and I never really felt any hip pain. But once the fall season started, it was kind of it gradually built up, my pain. It started with shin splints, which is normal for a lot of runners, but then it kind of spread to my knees, and then it was mainly my hip that I was experiencing a lot of pain with. And so I worked out a plan with my coach where I'd spend a week or 2 in the gym on the elliptical or the bike, and then I would go back to running for a week, training with the team as usual. But then after doing that, my pain resurfaced again, so I went to the gym a bit more and did the bike and like my own type of physical therapy and whatnot. And it continued to get worse, like dancing back and forth between the gym and training. So eventually I had to kind of call it quits for that season and just spend the rest of my time trying to get better, but my pain only increased from there, really.
And so for all the years that you had been a runner, you had never felt any symptoms like this or anything else related before?
No, never before. I really felt hip pain, but I think it was definitely that impact of running every single day for like 4 months or 5 months straight that really kind of overdid it, because I had never done anything like that before. I really started competitively running my freshman year, so this was all kind of like a new experience for my body, especially once I started getting better and wanting to push myself a lot more. But the pain eventually progressed to the point where even when I wasn't exercising or doing anything, like I would wake up in the middle of the night and I would have hip pain. I wouldn't be able to really sit in class, so I'd have to stand and take notes. And even like walking around school, it hurt a lot. So I guess that's when my family and I really knew that something definitely wasn't right, and it wasn't something that could be healed as easily as shin splints or something like that.
So how long were you experiencing this pain? So when did it start, and at what point did you get to this point of waking up in the middle of the night and really noticing that, okay, I have a serious issue?
Mm-hmm. So it started around mid to late September, so I was only a couple weeks into my season, and I would just finish a run and be really sore, so I'd get ice, but the soreness progressed, and it would probably be around November, I would say, where it was a serious pain, but it didn't hurt so much walking at that point. But then, like around the December, January time frame, I was in a lot of pain all the time. February was even worse, so like every passing month it got a bit worse.
So this went on for like 4 to 5 months.
Yeah, it did. And I tried different things. We went to a local doctor in my town, and we did MRIs and cortisone shots, and they found out that I had a labral tear, which through the MRI scan. So the doctor, his first reaction was immediately to go through surgery, and that kind of like made my family really nervous and scary because it just seemed so sudden for such a small tear that came up on the reading. So that's kind of where we started researching, and we found HSS.
So on a scale of 1 to 10, when you first had that pain, that was September 2015.
Mm-hmm.
So on a scale of 1 to 10, what level of pain were you at from each month that you were then going in?
Mm-hmm. So I would say around September, it was probably around 2 or a 3, but I guess leading up to right before my surgery, it was probably about like an 8 or 9 every single day. So it progressed a lot the more.
And so Mom and Dad, when you first started hearing Caroline talking about some of the pain that she was in, what did you think, at least in the beginning, during that fall time frame?
Well, Caroline was having a lot of shin splints, and we were like, then when it went to the hip, we're like, okay, just, relax it, ice it, never thinking we would get to surgery or that it was, something that really needed to be tended to. And even when we found out about the labral tear, they tried a steroid injection, and she got some relief from that. But then as the pain came back, like within 1 or 2 weeks after the injection,
Right.
Then we knew that, they telling us surgery, so we were like, okay, let's get a second opinion before jumping into having, a teenager's hip, looked into, right?
Definitely escalating every month, and I think we were learning that we had more to deal with here than, looking back at September.
And so when you first decided we need to go to someone to start telling us what's going on here, where did you start? Did you start with just Caroline's primary care physician, or talk to me just a little bit about the thought process there?
Well, when we found out, when she was focusing in on the hip, I think I called the pediatrician, and they said that we should probably see an orthopedist. So we saw somebody out here in New Jersey first. And then once they were suggesting surgery and we kind of were looking into the different conditions, we started doing an internet search, and we knew HSS was, so close by to us that
Right.
why not go there? It was like, and then you started the search within HSS.
And especially when it's your children, you want to be very thorough. I had known about HSS for a long time, but I hadn't really been up to date. And the second I clicked on the website, it became very clear, how I could find a doctor. And I think probably the initial most pivotal point for me and my family was the entry process was almost seamless. It was very collegial, it was very inviting, it was very easy. And then rapidly you could see just how thorough every individual in the organization was, and you could see how well connected every function in HSS was to the next function. And before I knew it, I realized we were in very good hands.
So when you decided to go to HSS, did you request an appointment online? Did you call a phone number? Like, how did you ultimately find the right surgeon for you?
I think originally I got to the office of the head of pediatric surgery, and then they referred us to Dr. Rodwell very quickly.
And that was Dr. Neil Ranawat?
Yeah,
Yes.
and we were able to get in really quick, and they also have an office here in Paramus, which is so close to us, which was key for part of, Caroline's even Postop portion. So sometimes we would be in the city, sometimes out here in Paramus, New Jersey, which was really nice.
So that's the outpatient center. Gotcha.
Yeah.
Great. And so once you got introduced to Dr. Neil Ranawat, what was that first experience like? What was he like? What did you think about him? Because obviously, I'm thinking that if I'm in high school and I'm being told, that I have all these potential issues going on with my body, I mean, I'm pretty scared, and so I want someone who I can connect with. And
Right.
so what was that first experience like for you? And then if your parents can then share.
I really liked Dr. Anna from the moment I met him. He walked into the room. He was very energetic. He, you can tell he like thoroughly looked over my file and my X-ray and everything, and he picked up on other things the previous doctor had not. He found out that I had a femoroacetabular impingement in my hips, which means they kind of have an abnormal shape, and when I move in certain ways, my femur and my hips really impact each other, and that is what ultimately caused the labral tear. But he was able to pick up different things the previous doctor had not. He presented me with various treatment options, which I was not given before, and I really appreciated that because he had not just gone to surgery right away. He told me I should go through 6 weeks of surgery, 6 weeks of physical therapy first, and then if that didn't work, we could move on to cortisone shots, and if that didn't work, we could see where we want to go from there, but usually the next step would be surgery. So I really valued being given those options and having someone who clearly cared about his parents, his patients a great deal.
And so you mentioned how you did all this research ahead of time, and when you met with Dr. Rodwell, I mean, did the expectations meet what you were looking for?
Absolutely. Yeah, very thorough, as Caroline said. And when we wrapped up, sometimes particularly if you have complex medical things, you're not sure where you're going. It was very clear what the next step was, and the next step, and how we would choose ultimately what to do. And through that whole process, post-diagnosis, he really helped us to arrive comfortably at the surgical option that we chose.
One of the things I liked about working with Dr. Ronowat was that he would talk to Caroline. You know,
Right.
Caroline was his patient, and you know, Caroline would come in with a list of questions, and you know, he really took the time and let Caroline ask the questions and go through all of that. So I
Right.
really like that. And I always just say, I love that Dr. Ronowat.
Yeah.
And this is actually a great time just for me to remind everyone that if you're looking to start or change treatment, just make sure that you always consult with your doctor first. So you meet with Dr. Rodwell. He presents these different options. Where did you go from there?
I decided to do the 6 weeks of physical therapy just because I had a cruise season coming up that I really wanted to partake in, amongst other activities. I had a busy summer coming up, and I really just didn't want to go to surgery knowing that I would have a lot of physical therapy afterwards. So I did the 6 weeks of physical therapy, and I actually did start to feel a lot better. A lot of my pain was alleviated, but even progressing through the physical therapy, the pain would still be there, and it would still be at the same level. It just wouldn't be constant all the time. It would flare up every now and then. And ultimately, after doing the 6 weeks of physical therapy, we discussed the cortisone shots or the steroid shots, and because I had previously gotten those and we figured that they did not work out, or they were not they were only a temporary fix, we decided to move on to surgery from that point. But it wasn't just like surgery right off the bat. It was a very gradual process. I was in the very good hands of Mike Dunn from Professional Physical Therapy, and he had this whole plan outlined for me as to how to get better, how to alleviate my pain, how to strengthen my hip, as well as other muscles in my body that would help take off a lot of the pressure that was put on my hips. And then we came to the decision together between Mike, myself, my family, and Dr. Ronowat that surgery would be the best way to go. And even after that, I was with Mike all the time doing physical therapy, so I knew I was in very good hands.
And during that time prior to surgery, was it frustrating? Was it, how difficult was it going through that process? I mean, nobody's anxious for surgery, but did it reach a point where it was like, I think we've got to make this decision?
I think we definitely did reach that point. At the beginning, I was actually kind of like pumped up for physical therapy. I was excited to do it because I was really looking forward to getting better and hopeful for what the physical therapy could do for me. But as I started that, my pain wasn't getting worse, but it wasn't necessarily getting any better per se. And so after doing like the month and a half of physical therapy, we kind of came to the conclusion like I can keep doing this as long as I want, but it's not going to really solve anything. And so we were kind of comfortable with the decision of going to surgery at that point.
So before we get to surgery, it looks like we have a question.
Sure. So Sharon said that she also has a tear in her right hip and she needs surgery, but she's afraid. So you're talking about now you're getting surgery. What would you say to her or anyone who might need it like you did but would be scared going into it?
I would say, I mean, I had a lot more going on than just the tear, as was discovered by Dr. Ranawat, but once I first found that I had the tear, I was very nervous. I was like Googling different things, and surgery did come up a lot, and I was nervous about that, but I would definitely say look at all of your treatment options, and if you can't find any, find a doctor that will give you an array of options, because I really value that. And if I did say just have a tear and I just stuck with physical therapy for a while, probably would never have done surgery if it was just that one issue, but I had several. But keeping up with physical therapy is probably one of the most important parts of the whole entire process, because if you even lay off a little bit on your physical therapy, you could be set back to square one, and possibly that could lead to a more serious surgery later on. So I would definitely say take it step by step, look at your options, and if you're nervous for surgery, I would not do it right away, but try to reach the point where you're comfortable enough to proceed with the surgery, or comfortable with any option you're given.
And I think just from the parents' perspective, if you can speak to sort of the scariness of it and what advice you might give to others.
Yeah, Caroline alluded to looking up on the internet, like all these things, and the internet to me just has all of this horrible information out there, and I just kept telling her, like, get off the computer, listen to Dr. Ranawat and his staff, and it really just followed the course with them. Like, I just felt like we were in very capable hands. You know, it just seemed that they had a plan for us. It wasn't just come in and have surgery and then go find your rehab doctor. It was set up. Like, you know, we knew we were going into surgery. We had the places calling us to send, you know, to bring the equipment here, or we would get the equipment. You know, they were training us on how to use, like, the ice machine that Caroline can probably go into later for people, but it was just the entire plan from surgery to post-op to rehab and all the follow-up. We knew what to expect the entire time. Yeah. So going in that day, I don't think we were that nervous.
Yeah, I wasn't that
I think
nervous.
we had been like, okay, we're going to do it, and, you know, on we go. You know, so.
I think the other thing is different people arrive at their comfort zone in different ways and in different amounts of time. And I never felt rushed or pushed. I don't think Caroline did.
No.
And you know, you always knew they were willing to have one more conversation. You know, for us, it was a couple of conversations, but they were very thorough. They sort of humanized the process, and we landed in a very comfortable spot.
Even the day of surgery, it was seamless. We come in, we got registered, you know, brought us up. They showed us again how to use different things, and then, you know, it was just right away. It was everyone was friendly and helpful.
Yeah, very nice process. I would say it's very important knowing that going into a surgery, it's really only up from there, as like given that you do keep up with physical therapy and the different recovery options you're given, but surgery is kind of like the bottom, and the like HSS, your family, everyone around you is only going to be working to like help you go up from there. So
it's the start of getting better.
Yeah, right? You get nervous doing it, but there is kind of a hopefulness in surgery, knowing that, like, say you do choose that option, you'll be in a much better place than before surgery.
So surgery comes in, how long was your surgery?
My surgery, I think, was about 3.5 hours.
Yeah.
Once I got like various 3D CAT scans and whatnot pre-surgery, just so Dr. Ranawat and his team could get a better idea of what they were really going to be seeing once they began the surgery. But once they did, they found out that I had a lot more inflammation than expected, and something sort of more severe or extensive than they thought. And so the surgery was originally supposed to be around 1.5 hours, I think, but it took a bit longer, but ultimately it was fine.
And so surgery's over, Dr. Rodwell comes out, and what did he share with you both?
Well, he came out in the middle of the surgery, I believe, right? And said that he had encountered a lot of inflammation, so I think he had a little bit more to go.
Yeah, it was going to be a little bit longer, but everything was going great, so everything
So we
was
felt
fine.
very informed and knew that she was okay. Just the communication was good, and I think most importantly, he felt good about what they'd been able to do.
And so you come out of surgery, did you feel a sense of relief, or did you sort of feel like now is the hard part, now is the rehab, now is the recovery?
Yeah. I did have kind of a sense that I would be beginning the hard part, but it was the first couple of days were actually kind of a blur for me. I don't really remember them all too well, but I was in I was supposed to be in physical therapy the day right after my surgery, but I wasn't feeling too well, so we pushed it to 2 days after, and it was definitely hard in the beginning. I only had a couple exercises, so it was about maybe half an hour at first. I would do different band exercises, stretching and whatnot with Mike, and I would say it was difficult in the beginning. Just it was really only those first 2 weeks though, and once I kind of got over that hump, my physical therapy ended up being 2.5 hours long in the thick of it, but I'd be able to run, swim, do the elliptical. The bike was definitely the biggest thing that we really focused on, because that would really help my range of motion, different stretching. So although it seems like the physical therapy really flew by when I was there, and just getting over that first week or so is really helpful, and I felt a lot better after that.
And before we continue with the recovery, looks like we have another question.
The question is from Tanya. How long was the recovery?
My recovery was about 4 months of physical therapy. I got the surgery in April of 2016, and I finished my physical therapy in mid to late August. But after a while, I went three times a week for the most part, and then once I got around to July and August, I was able to cut it down to 2 times a week, and I would be able to do more running at physical therapy rather than stretching and different weights and whatnot. So your physical therapy program is constantly changing based on how well you are rehabilitating. And so for me, it was every time I went there, I was doing a new exercise. I was getting to run a bit more, or bike a little faster, something like that. And so 4 months does seem a lot. I think for my hip surgery, the predicted amount of time for recovery was 4 to 6 months, but it really depends on how fast you recover as a patient. I know I was on the 4-month side of things, but there are other patients that have been on the 6-month side. So it's just how you work that out with your physical therapist, really, and how you are feeling as a patient, and how much you are willing to push yourself in the recovery process.
And your PT, so this was in the city, which is 25 miles or so from here, give or take?
Well, I actually did physical therapy in, I forget which town it was, in Wayne, New Jersey.
Yeah.
And so
15 minutes away.
Yeah,
Right.
15. So it wasn't bad. I did that 3 days a week. It's been probably about 3 hours round trip there, 2.5 hours there, and then
Well, Caroline doesn't go to high school here locally. She lives away for high school, so we would pick her up, bring her in, get physical therapy, and bring her back. But she was pretty much, after 2 weeks of surgery, she went back to school and was sort of getting around on crutches, and then it was 2 crutches, then it was 1 crutch. So it was just a bit, progression moving along, And it was always good to see Mike, if Caroline had a question or she felt maybe a little twinge of pain, it was always reassuring that we would see Mike in a day or 2, and he would let us know.
Another important point is Mike, the physical therapist, set things up so that it would work well with the trainers at her school. Mm-hmm. So again, it's just another example of how the communication, basically the hub being HSS, just reaches all parts of the person's life.
And were you having post-op follow-up? Was it, how often were you seeing Dr. Rodwell?
I think I was seeing Dr. Rodwell maybe once every month. Yeah. And then it was kind of every 2 months, 3 months. So it really depended on where I was at in that point in my recovery. But I always left his office with a new plan. He had it all lined out, everything where you should be at 4 to 6 weeks, 7 to 8 weeks, things like that. And so he was always very thorough, even in his post-ops. Wanted to make sure that you were feeling okay as a patient. Wanted to make sure my parents were comfortable with everything. And
he would always give you another plan to bring back to the physical therapist,
yes.
right, to increase where Caroline was.
Right. And if I like had any pain still in my hip or anything, we'd kind of take a step back and be like, okay, maybe this week we go back to like 4 to 6 instead of jumping straight to like 7, 8 right away.
And so at what point in your recovery did you think you had turned the corner and now you're sort of, seeing the light at the end of the tunnel?
I think it was definitely around June. I was, I got my crutches off earlier than I expected. I was able to go back to school earlier than I expected. And so I was doing everything kind of ahead of schedule, which made me really excited. So I started trying a lot more in physical therapy. And
tell them where you went then.
Yeah, I think around June, late June, I went to England, and I was able to walk all around the country in London and whatnot without a problem. Then we went on family vacation, no problem there. And I still had a little bit of hip pain, but nothing like, I always had my physical therapy band in my suitcase, so if I ever got back to the hotel and I was in pain, I'd do a couple exercises and I would be fine 10 minutes later. And so the pain definitely was not apparent at all, really. It was just those very rare flare-ups every now and then, but nothing compared to what it was. And then come mid-July and August, I was up at camp and I was able to canoe like 200 miles, which I never thought I would be able to do in April when I was getting ready for surgery. So it was kind of like nothing had ever happened by the summer when the summer came around.
I think you surprised Dr. Rodwell.
Yeah.
Yeah. So now, fast forward, we're now over a year from surgery. Mm-hmm. How are we doing today?
Doing great. I haven't felt pain in months, really. Still a 3-season athlete. I switched over to swimming as part of my physical therapy program, so I've been swimming for 3 years now. Still doing cross country, and I picked up rowing recently, which I love and I'm doing really great at. So it's really like, if you looked at me, you would never know that I've gotten surgery. Sometimes I forget that I even had it just because I feel so normal again, and it's really been like a wonderful time working with Dr. Rodwell and his whole team in HSS, because they really make sure that you go completely back to the way you were. And
so before, I know we've got just a couple minutes left here, Mom and Dad, any advice for other parents or families that might be tuning in, that whether they're going through a similar condition to what Caroline went or something else, any advice that you would give to them when they're looking for what to do and where to go to for care?
Definitely HSS. Dr. Rodwell, if he's an option. And I think just following the plan that they put out for you, mm-hmm. From the start to finish of, going to physical therapy, really ensuring that, you continue with that. That's a big part of the whole mm-hmm. recovery. And I think credits for Caroline is today. You?
Yeah, I think there's a lot of anxiety, or there can be a lot of anxiety around healthcare choices these days. And I think at HSS you can just be comfortable and ask all the questions you want, and they give you full access to any professional you need, and it's a good place to be.
Yeah.
Well, Caroline, we're glad that you're officially back in the game,
yes.
and for those of you who want to read more about Caroline's story, again, she submitted it on our Back in the Game Patient Forum. It's the largest of its kind. Again, you just go to hss.edu/Back in the Game. So once again, we're coming to you live from Bergen County here in New Jersey. About to sign off. So Caroline, Mom and Dad, thanks again for having us.
Thank
in
you.
your
Thank
home.
you.
And if you have any other questions, feel free to comment below. Thanks again for tuning in.